Our guest today on the Being Human podcast is Dr. Angela Tan. Dr. Tan is a family physician in Singapore who specializes in sexual wellness. Dr. Tan, thank you so much for joining us today.
Yeah, thank you, Lisa, for inviting. I'm really excited to share what I know with your viewers today as well.
Yeah, it's important work that you're doing. So I want to get your insights into women who are working full time. They're often raising kids. They're just flat out trying to keep it all together. And then boom, they get a breast cancer diagnosis, which is bad enough. And they're trying to factor that in and juggle that as well. But there are hidden dangers as well, other pitfalls that are lurking that can jeopardize a woman's marriage or relationship. And this is what you specialize in. Tell us about
Mhm.
that.
Right. So I work with a number of women who fits what you were exactly describing. All seems great. Their career was taking off. The children are starting to grow up and to be less dependent on them. And they thought they have this bright future ahead where they will retire, have a good life. Then what came next was a breast cancer diagnosis. And then with that, all the dreams that they had shattered in the moment.
Yeah, I can imagine. And it must be like a feeling of a total loss of control when that
Mhm.
happens. What do you see?
Yeah.
What do your patients tell you?
Um, well, in the first months, you're talking about 6 months to a year, they are
Mm.
busy grappling with treatment. So that's where they talked about, chemotherapy, whether they need to have surgery, what type of surgery. Is it like a full mastectomy where you remove the whole breast? Or some of them, they are able to handle it with just a lumpectomy, where just remove the lump itself. Some of them will opt for a reconstruction in the same sitting. Some might opt for reconstruction thereafter. So in the first phase, there was a lot of discussion. There was very
Mhm.
medically intense, focusing on the survival. Right? I
Yeah,
think,
yeah.
yeah. So when they actually come to me, by then, survivor is no longer the top of the head. But in this very intense and overwhelming phase, they didn't realize that how much it has taken a toll on the marriage, on the sexual life,
Mm.
and who they are as a woman.
Oh my goodness. So they keep it together with their kids, their
Mm-hmm.
careers, they get through
Mm-hmm.
the big decisions on breast
Yes.
cancer,
Yes.
lumpectomy, getting breasts removed,
Mm-hmm.
and then their marriages and relationships start to fall apart. Tell us about that.
Well, sadly, right, a few of my clients who came to me, they have been survivors for a good 2 to 3 years. And unfortunately, they discovered that their partners were having affairs during their
Hmm.
treatment phase, right? And I think that is a huge thing on top of whatever they were grappling with. So when they came to me, a lot of time it's like, tell me, doctor, what should I do? Should I stay in this marriage? Should I leave? I'm like so broken. I thought, I went through this huge thing about breast cancer and I survived. And now this is happening to me.
Mm. So your marriage becomes vulnerable
Mm-hmm.
when both partners are sort of focused on getting through the cancer
Yes.
diagnosis and
Yes.
surviving it. So your marriage is
Yes.
vulnerable then.
Mm-hmm.
And then after that, there's
Mm-hmm.
also the risk that comes along with forced menopause, which a lot of women have to go through because their cancer is hormone, what's the term? Estrogen receptor positive?
Yeah.
Is that right?
So they need hormonal treatment to suppress the estrogen in their system so that the
Mhm.
risk of having a recurrence get reduced. So with estrogen suppression, basically you are having a medically induced menopause. So a menopause that happens way before your actual age, right? And you start
Yeah.
getting the symptoms in a quick rush. Because in a typical menopause phase, you have 7, 8, 10 years as it slowly slips into your life, right? But with a medically induced menopause, you start the medications and within days or you're actually in a full bloom menopause state. And other than the hot flushes that we know of that we heard very commonly about,
Yeah.
um, what most of us don't realize also contribute to the menopause symptoms include things like brain fog, loss of concentration, mood irritability, And then you just find that you can't think, you can't manage yourself. Like you are this woman who runs a household, who runs your department, and suddenly all those are not possible because you're just in this state that you can't focus, you can't concentrate, and you don't know what's really going on in your system.
Oh my gosh. I've never actually considered that before for professional women. So they're moving along, they're doing well, they get breast cancer, they get through it. Then you've got menopause symptoms, which are horrible because I've gone through it. I'm in that age bracket,
Mhm.
and it's brutal. Um,
Mm,
and then on top of that, so they could be in their 30s with young kids, and then on top of
mhm.
that, they also lose interest in sex, you were saying, and that
Yeah,
causes more problems.
yes.
Tell
Right.
us
So it's
about
not
that.
just
That's
about
not easy
losing
for the
interest in
relationship.
sex.
Yeah.
So physically, with the menopause symptoms, they can also get vaginal dryness, right?
Mm,
And even wearing a pair of jeans can be challenging, right? Because jeans, they're tight fitting and they're quite thick. So there's a lot of friction in the whole
mm,
genitals and vulva area. So even wearing a pair of jeans has proven to be impossible.
right.
So one of
Right.
my patients who had menopausal symptoms came to me, and she didn't realize that she has denied herself of wearing a pair of jeans. And when I started her on moisturizing treatment, within 2 weeks, the best news that she brought me with, I can finally wear denim pants.
So getting her fashion choices back was a
Yes,
big deal. It seems small, but it is a big deal.
it
It is
is.
a
It is. So it's not just about sex itself. It's like there's so many little things that matters to us, the quality of our life and who we are, that get tied in with all these symptoms that the women are going through,
mm,
right? And of course, with vaginal dryness, another problem that they can have is recurrent either yeast infections or even urinary tract infections. So for those
right.
women out there who experience an urinary tract infection, you know how disturbing it is. It doesn't cause you to be hospitalized, but the frequent trips are going to the toilet, and every time you go, the intense pain for that few
Mm.
seconds, you
Yeah, it
dread it.
slows you down. It slows you down when you're young, you're living a full trying to live a full life, all of this certainly gets in the way. So what about, your advice for the partners of women who are going through all of this? Because I'm sure within the marriage, it can all seem very, isolated. They each focus
Mm-hmm,
on,
mm-hmm,
trying to get her through, the breast
mm-hmm.
cancer diagnosis. But what's your advice to partners and couples who are struggling with this?
Well, I would say the advice is to know and be aware that the relationship can take a back seat, and that's okay because when there's other things that requires our priority, right? The relationship can take a back seat, but not forever. But to
Mm,
recognize when is a good space for us to recenter and realign and go like, hey, we have been neglecting our relationship. Perhaps it's time for us to talk about it. How have we unknowingly put it at the side, and how have we unknowingly put other things first? When is a good time for us to re-establish the couple relationship, put the lover's role back into place and not the caregiver's role as the main priority? So it's about recognizing
mm,
that it will happen and planning when to re-establish it as the most important thing.
mm. And what about the sex part of it? Because if they're in forced menopause,
Mhm,
they're not gonna be as interested in sex as before, and that's
mhm.
gonna have ramifications for a young couple.
Yeah. So then this is what I tell young couples is the focus will not be about intercourse because sex comes in so many forms, right? How does intimacy looks like for you and for you is going to be very, very different. So when the time is right, that's where we talked about, being able to put things back in place. It's also good to talk about what are the little steps of intimacy that we can start bringing into a relationship. It can be, as a start, if they are not quite holding hands and cuddling yet, to restart that. And if they are, look into passionate kisses as something more often to be carried out. Okay. And if they already are, then start exploring mutual masturbation. Or maybe just a person gets to have the pleasure first. You don't need both to be in it all at the same time. And also sometimes, bringing toys and other devices to help along reduces the stress and reduces the work we need to help someone finish that way. So there's a lot of interim that we look at, right? So that we can kind of like pace it at everyone's comfort level. So it's never about all the way intercourse. And
Mm,
also to recognize the symptoms that the woman may be going through, and how do we then prepare for that. So moisturizers, vaginal moisturizers is something that I highly recommend among women with menopausal symptoms. And if that's not quite enough, we actually add lubricant during
mm,
intercourse itself, just to reduce the whole fear around it.
mm. From a psychological perspective, how many of your excuse me, how many of your patients come in and they're completely surprised by all of this aspect of breast cancer?
I would say pretty much everyone.
All of them.
So I kind of like attend breast cancer support group as well. So in these groups, I meet hundreds of women,
Mm,
right? Even though this is a thing that is on your mind, but they don't really talk about it.
of course, yeah, it's very private.
Yeah,
It's
so
very must be very difficult to talk about.
it's challenging. So I'm glad there are some like seniors in the community that actually try to kickstart the conversation and share with them like what they went through, and hopefully these lessons can be passed down to the
Mm.
ones that are newer into the journey, right? And then when I pop by, then I get asked the more difficult questions.
They pull you aside and they sort of whisper, "So this is happening. Can you help me?"
Yeah. So then this is where I bring in the medical aspect of things, and also bring in the psychological aspect, how to
Yeah.
rebuild the couple's dynamics after going through a challenging journey together.
Yeah, it's such important work that you're doing, and I've never ever considered this aspect of breast cancer before. So thank you for bringing my attention to it. And I have to think that just being aware that it's a pitfall
Mm-hmm.
might help a lot of couples navigate it, where they go, "Oh, okay, it's not a problem with us. It's not us.
Mm-hmm.
It's this over here. This
Mm,
is the problem, and we
mm.
just address that, and we'll be okay."
Yeah. Yeah. So one of the things is people do not recognize that, there's this potentially this problem. So what we are doing here is highlighting, yes, I get it that survival is really important right now, and I totally respect that. But when you're ready, this piece of pie is ready for us to explore. So it's just really planting the seeds.
Hmm. It's really it's such a fascinating area. So tell me, what's your advice to your professional clients who come in,
Mm-hmm.
and um, and I know you're helping with the medical stuff, but you're also helping with the psychological aspect of
Mm-hmm.
things as well. What's your advice to professional women who come in and they feel like they've just completely lost their sense of control? Like 6 months ago, they were probably flying high,
Mm-hmm.
living the professional dream, had a family, everything was great. And then boom, it all kind of blows up. That's
Mm-hmm.
a huge loss of control for
It
people,
is.
for
It
someone
is.
who's used to being
Mm-hmm.
very in control.
Mm-hmm. Mm-hmm. So my advice to these women out there is really, 5 years, 10 years, when you look back in this period of time, you ask yourself, how did I get through? So all of us will get through it, right? And holding that hope at the end, it's kind of way that saying, okay, I'm lost right now and I don't know what's my next step. But if I keep going, I will eventually get out. And I know I will. Just having that thought, right? And allow the rest of us to be your support team to take you through it.
Yeah, that's wonderful. Well, thank you so much for joining us. We really appreciate your time today.
Thank you so much for having me, Lisa.